Hi, my name is Abdul Razak. I am a performance specialist and an auditor. If you are interested in learning virtual scribing, you have come to the right place. Please subscribe to this channel for more such videos. Today we are going to talk about elements of HPI and also a little about E&M coding and CPT guidelines. When writing a medical record, there are certain guidelines which we need to follow. These guidelines are E&M and CPT guidelines. Let us take an example. In India, when a person sees a doctor, for example, a patient sees a doctor for fever, the doctor would ask the patient questions and would perform a physical exam and prescribe some medications. After the visit is over, the patient would pay his or her fees to the doctor and buy their medication. Likewise, in America, after a patient sees a doctor, the patient is not supposed to pay the fees at the end of the visit. This fees is paid by an insurance company. Every visit has to be documented either by a medical transcriptionist or a virtual scribe. Earlier, a doctor would see a patient and after the visit, the doctor would dictate the entire visit through dictaphone. This report would come to a medical transcriptionist who would type what was dictated. Then this report would go to a medical coder. Then the insurance would pay the money to the organization or the clinic. Now, these days, a virtual scribe present would document what is discussed during a visit, and this report goes to the medical coder, and then the payment is made by the insurance company. So for documentation purposes, there are certain guidelines which we follow. Medical billing is the process of generating healthcare claims and submit them to insurance companies to obtain payment for medical services rendered by providers, clinics, hospitals, etc. After translating a healthcare service into a billing claim, a medical biller follows the claim to ensure the organization receives reimbursement for the work the provider performed. E&M stands for Evaluation and Management. E&M coding is the process by which physician-patient encounters are translated into 5-digit CPT codes to facilitate billing. CPT stands for Current Procedural Terminology. These are the numeric codes which are submitted. That was a brief explanation about payment, medical billing and E&M codes. E&M codes and CPT guidelines are taught to a scribe as a different subject. Here we will just cover this subject very briefly so that there is a clear understanding of what needs to be documented. So let us begin with the elements of HPI. There are 8 elements in HPI. As you are aware, history of present illness or HPI is a chronological description of the development of a patient's present illness from the first sign or symptom to the present. There are 8 HPI elements. The first HPI element is location. For example, left leg, this is where the injury occurred. Number 2, quality. The quality of the pain is aching, burning or radiating pain. Number 3, severity. The pain is rated at a 10 on a scale of 1 to 10. Number 4, duration. For example, the pain started 3 days ago. Number 5, timing. For example, the pain is constant or it is intermittent or comes and goes. Number 6, context. Example, when the pain started. It started while lifting a large object at work. Number 7, modifying factors. For example, the pain is better when heat is applied or after a medication is taken. Number 8, associated signs and symptoms. For example, numbness in toes. Now there are two types of HPIs. A brief HPI includes documentation of 1 or 3 HPI elements. For example, patient complains of earache. The pain is a dull ache in the left ear for the past 24 hours. So this example has 3 HPI elements. Whereas an extended HPI would contain 4 or more elements of the present HPI. For example, the patient complains of earache. The pain is a dull ache in the left ear for the past 24 hours. The patient states he went swimming 2 days ago and symptoms are somewhat relieved by warm compresses
If you like the video
and
please
ibuprofen.
subscribe to my channel for more such videos. Also share this video with your friends, and if you have any doubts or questions, please write them down in the comment section. I will try my best to answer any of your questions. Thank you.